So good morning, everybody. I'm Dawn Genvy, and I'm a research manager in the Patient and Public Involvement team at NIHR. Welcome to the second in our PPI in Action webinar series. Today's presentation is focused on PPI with policymakers and practitioners. Before the presentation, I'll just run through some general housekeeping rules. So you can enable captions by clicking on the CC button. And if you'd like to ask a question, please click the Q&A button. You can select send anonymously if you don't want your name displayed with your question. Once you've finished, please remember to click send to submit your question. We'll be answering the questions at the end of today's session. I'm delighted to now hand you over to Dr. Danielle House.
Hi, morning everyone. Alan and I can just quickly introduce ourselves before we get going. So I'm Daniela House, and I was the study manager for the Active-6 study, which was in the Centre for Exercise, Nutrition and Health at Bristol University.
And my name is Alan Inman-Ward. I am CEO for HK Gloucestershire, but at the time of this, I was Director of Insight and Operations at Active-Gloucestershire.
So in the next half an hour, we'll briefly explain what the Active-6 study was, and then we'll focus on PPI with policymakers and practitioners and how this really improved our dissemination of the study findings. And then we'll each share some learning from the process. So I'm sure you're all aware, but for anyone new to this, PPI, or public and patient involvement, refers to the collaborative process of including members of the public in health research. NIHR has developed 6 standards for public involvement in health and social care research to improve its quality and consistency. We've referred to them throughout this presentation that will follow, where our work speaks to one or more of them by putting a coloured circle at the bottom of the screen that corresponds to the cogs you can see on the screen now. But just to briefly go through them, the 6 standards are communications that use plain language, are well-timed and relevant, working together in a way that values all contributions and builds mutually respectful and productive relationships, inclusive opportunities that are accessible for a range of people, impact, which is improving research impact by sharing the benefits of public involvement in research, governance, so public involvement in research management, regulation, leadership, and decision making, and support and learning to build confidence and skills for members of the public in research. So Active-6 was a study that measured the impact of the COVID-19 lockdowns on children's physical activity levels. Physical activity is really important for children's mental and physical health and well-being. But before the pandemic, only 41% of UK children met UK Chief Medical Officer and World Health Organization physical activity guidelines. When the COVID-19 pandemic hit and schools were closed and people were asked to stay at home, there was potentially a really big impact on children's physical activity. From a previous study, we had device-measured physical activity data from 10 and 11-year-olds in the wider Bristol area, as well as parent and child questionnaire data. When we went into lockdown, there was a clear opportunity to use that data as a baseline and return to the same schools to measure physical activity levels of the same aged children as we came out of the lockdowns. So in April 2020, the Active-6 study was funded by NIHR through a public health research fast track call. We collected data from pupils and their parents in 2021 to measure the short-term impact and 2022 to measure the medium-term impact. The key aim or rationale of the study was to quickly collect and analyse data and to use it to rapidly inform policy and practice decision-making. It was quite a large study with large numbers of schools and families involved, as you saw on the previous slide. And we would hopefully be generating some very useful and interesting findings on this potentially very impactful event. So key to this was working closely and collaboratively with a range of policy and practice stakeholders throughout the project, building good relationships with these people and organisations. We saw policy and practice colleagues as a key stakeholder or public in our project. In order to do this, we built PPI into all aspects of the study, not just with policy and practice colleagues, but also with schools, children and parents to make the study as best as it could be. At the grant application stage, we had teacher, parent and child input on the data collection plans, but importantly, we had policy and practice colleagues write letters of support for the grant application and explain how the data would be useful to them. I'll come back to this later on and explain exactly how we got their involvement. Once the study was funded and up and running, we recruited a parent member to the study steering committee, which had oversight of the project, and another to the study management group, which oversaw the day-to-day management of the project. We had child, parent and teacher input on all data collection materials and guides and processes, both ways of the data collection. And which we'll focus on in this webinar, we established an impact advisory group of policy and practice colleagues to advise us in all aspects of the study. So we established the impact advisory group to be a main mechanism to gain the expertise and on-the-ground experience of policy and practice colleagues. They advised us on our data collection plans, and we shared our findings, preliminary ones as we were going and final, directly with them as rapidly as possible to inform their decision-making and their work. Members included national, regional and local stakeholders in various sectors that crossed over with children's physical activity. I think we had about 25 members of the group around the time of this project, but it wasn't fixed. So people joined and left throughout the study as we made new contacts and when people moved roles. We had a good spread of organisations, both geographically and in terms of the focus of their work as well. And in terms of exactly who within an organisation joined the IAG, this did vary depending on the type of organisation, but more often than not, we were working with people who led on data or insight within these organisations, like Alan, who saw the value in the robust and timely data that we were producing. So in terms of setting up the IAG, it began with contacts that the research team had previously established. But as I mentioned, the group grew over the course of the study. We also identified gaps where we didn't have contact or representation and tried to include those organisations. Sometimes this happened by chance, by being in a meeting and developing networks. And sometimes we were introduced to other people through the IAG or other contacts that we had. And other times we just reached directly out to an organisation to see if they would be interested in joining and finding out about our study findings. So, for example, we had colleagues in the group from Scotland, from Public Health Scotland and Active Scotland, but no one representing Wales. So we identified someone at Sport Wales and reached out for them to them for a chat and brought them into the group. And at the same time, the study PI happened to meet someone from Public Health Wales, so they also joined. I'll come back to this in the learning and reflection later on, but just to make the point now that this was quite a long process of building foundations and relationships with people and organisations. But because we wanted our findings to reach a wide policy and practice audience, we kind of cast quite a wide net with this group and tried to bring lots of different organisations together. We convened an online IAG or impact group meeting roughly every 6 months, where we shared next steps for the project and emerging preliminary data. Not everyone attended each meeting, but we had a large and broad enough group to have a decent turnout and productive conversation each time. People varied in how much they participated, but in general, and Alan can share his feelings on this, I think the group felt quite included in the study and hopefully they felt like their contribution was valued. But from our perspective in the research team, it was extremely helpful to have the IAG for immediate feedback on whether our emerging findings were matching what our policy and practice colleagues were seeing on the ground, and to shape the study while it was in process.
So I'm going to just give a bit of a perspective from a member of that group. So as I said, I was the Director of Insight and Operations at Active Gloucestershire. And we're one of a number of active partnerships across England. All counties have one, and they are funded by Sport England and for Active Gloucestershire by the NHS Gloucestershire as well. And the role for active partnerships and Active Gloucestershire was around creating a movement for more physical movement and engaging with people to alleviate any health inequalities. And we used a range of evidence and research to inform our work. And these ranged from our own internal evaluation, national research by Sport England, such as the Active Live survey, and also academic research. And this all helped us to drive the focus of our work, such as who is at most risk of health inequalities, where we work, such as areas of high deprivation, and what works to make a systemic change of good in a complex world and bring people together to collaborate. So when we're actually developing our social movement, We Can Move, we changed our approach, moving from delivering physical activity opportunities to actually working with all the people across the county and nationally to try and change the system so that all the barriers were removed. So as we were looking at this approach, we wanted to evaluate the impact of that change and how we deliver those opportunities, and focusing on what we learn and how we adjust our approach over time. So to achieve this, we worked with Arc West and University of Bristol on a 2-year project, which included an embedded researcher. So that really provided the basis for a very strong relationship that was built up over those 2 years. And as a result, we had a few peer-reviewed papers, a couple of which I was honoured to be a co-author on. And as an organisation, we were keen to pioneer new approaches, and we wanted to continue building our relationships with academia through ongoing partnerships with Arc West, and also developing other relationships such as with Hartpury University. Therefore, we're very open to being involved in developing new research, supporting, offering letters of support, and being involved, as Danny was talking about. From that perspective, it was we felt we could bring a layman's view as well on the work and how it can be of use to us and other organisations in the voluntary sector. And there were several benefits for us being involved. So we gained insight into the development of the new and innovative research. We provided the opportunity for a range of voices across different geographies and nations, and sharing that learning between us as well as back into the project itself. And also that opportunity to add wider learnings to be considered in the research, so such as the national survey data that we had access to, and understand where the results aligned or where they differed to help sort of add to the context to the data and the research itself.
So what we'll go into now is a little bit in detail exactly how we disseminated the project findings. So returning to the key goal of Active-6, our goal was to share the data on the impact of the COVID-19 lockdowns on children's physical activity with policymakers and practitioners rapidly in order to inform their work and their decision making as we all emerged from the pandemic. We needed a dissemination plan to reach this audience across the UK. And we wanted to make sure we were creating relevant outputs and resources for all of our key audiences and stakeholder groups. Involving the impact group in this dissemination plan seemed like a way to strengthen both the outputs that we would make and also how we could share them. So kind of quite serendipitously and luckily at the time, I was able to attend a workshop on communications planning run by the Arc West, and followed their advice to make a communications plan, and specifically to map out stakeholders or audiences, channels, and tactics. So stakeholders are fairly straightforward. It's the people that you wanted to reach. But the channels are the how and the where that you reach those stakeholders. So like how and where the research findings can be shared and disseminated. And the tactics are the resources and the materials that you make to share via these channels. For me, it was particularly helpful to think about the channels because I had a sense of our audiences and tactics, like what we would make for who, but I'll come back to it, wasn't entirely correct. It definitely adapted throughout this process. But I absolutely had a gap in my assumptions about how we would, the resources that we would make would actually reach those people that we were trying to share this with. So I went away from the training and I made a first stab at mapping out the Active-6 stakeholders, channels, and tactics as I saw them at that point, which is the image on the slide. Please don't worry about reading the tiny font on this. It's not really important to see the detail of what this says from back then, but I more just wanted to share this diagram to show how I used this as a planning tool in practice, and how I created this to help plan our work out. So I began with thinking about which groups would be interested in our study findings, who they could impact, and who we'd want to reach. Then I filled out the channels and the tactics that I knew about based on what the study had originally planned for, what I'd learned to date from the impact group members, and any kind of knowledge and experience I had from previously doing this. But mapping this out showed me that it showed me what we were already doing and planning, but most helpfully, it showed me which groups we were missing from our previous plan, and how I needed to think a lot more about the channels that we could access to reach those groups and the appropriate tactics or resources for each of them. Again, I'll come back to this later on in the learning, but I just wanted to say now that mapping this out also made me feel a bit overwhelmed, realizing that each stakeholder group would need tailored resources and how much work this would be. So, for example, that a policy briefing wouldn't, for example, be the right thing to communicate our messages to schools and the schools that are involved in the study. But I think the important bit is that through doing this, you have an awareness of the big picture and what could be done. And then you can be strategic about what you use your sort of very limited time or resources on, and target what to work on. So I'll just focus on what we did with policymakers and club providers on the previous slide where the two orange arrows were pointing. So I realized it would be extremely useful to have the involvement of those sectors in the planning process. So I turned to the impact group for help with this. I identified about 5 people in the group who worked in different sectors and regions of the UK, and Alan was one of these, and asked if they would mind having a chat with me about dissemination plans. In those chats, I shared the ideas that we had and asked people what the main channels were that they found evidence or industry communications, if I'd captured the right channels in my plans, and if they could suggest any others. I also spoke to them about my plans for the resources that we would make and asked what would be the best resources and formats for our data for them and others in their sector. Like, what would be the most useful and appropriate materials for them to have. We then took our dissemination plans and all the draft resources to the wider impact group for their feedback, both in meetings, and we did this virtually as well. And this process was extremely helpful. So Alan will give a few examples shortly, but these conversations opened up channels that I hadn't known about before. And I also think it again helped to build the kind of buy-in across the study and the impact group. The people in the group basically were really happy to share the findings and help with dissemination, and yeah, use their networks and their channels that they had access to.
So as Danny said, yeah, as a group, we were really keen to sort of share our learnings and learn from the findings as they were being analysed and presented. The Active-6 data was critical in providing sort of robust research on the impact of COVID and its restrictions on children. So at Active Gloucestershire, this was really timely for us. There was a number of different projects that we were looking at where this could help inform and influence that work as well. So throughout the process, it was helping us there. So there was one where we were working with schools to find ways to bring physical activity into the whole day as opposed to specific lessons, so creating active schools framework. And this research provided further evidence of the need for different approaches to increase the level of physical activity in children. For me, I think it was important that with the dissemination that there was a range of methods used, so that things that would work for different people that would be reading it. So the slide deck side of things was really useful. It followed on from what we were seeing throughout the meetings, and it helped us to understand the sort of more detail of the data visualized information, and provided us opportunities to ask questions of the team and go into more detail. But then it was useful then as a way of presenting the information at the end. The policy briefing really helped summarize the key findings, and also importantly, from Active Gloucestershire's perspective, where we're trying to change a system, is what needs to change, and helping direct and reaffirm what our thoughts were on the needs for children and also what the barriers that they were facing. With the channels, so Active Gloucestershire at the time, we had a public insight hub. So this was a storage of research, data, evaluation, which anyone could access, and we tagged it and coded it. So what we were finding is it's a way of people being able to find stuff without having to just go straight to Google, especially for the team at Active Gloucestershire. So this is one of those researchers, that pieces of paper that went into that hub, and again was really useful to sort of be able to have access to that very easily and readily. We also looked at how we can disseminate it. So we had a blog which Danny created so that we could sort of talk about the release of the paper and talk about the learnings and the findings. And so that was able to be shared across all of our stakeholders within We Can Move as well. So again, extending the reach into different channels of people that may not normally read academic papers. And so that approach really helped well. For me, the benefits were really about helping and influencing the communications. And it was great that Danny was so responsive to kind of looking at different ways to improve those communications, especially for kind of non-academic readers, but also then to widen the reach of the information and the findings, so that there were more people that really invested in sort of the health of children and young people, and how they can sort of use this information to influence their own work. And so for me, that was an absolute key benefit to being part of this.
Great. So I will now just briefly share some of the resources and the work that we did to disseminate our findings to policymakers and practitioners. And I'll try and focus on bringing out the role of the PPI involvement in these. So as Alan mentioned, he and other colleagues from the impact group, particularly those that worked in data and insight roles, advised us that a slide deck of all study findings would be the best way for them to have a record of our findings and to be able to use it as a resource for them going forwards. So the slide deck we created is quite large, and it includes all details on the study design and background, all our findings from each analysis we did, and implications for policy and practice. The impact group all gave us feedback on the draft of this, and then we shared the final copy with the group. And as Alan mentioned, he and others were then able to save the slide deck in professional channels. So in Alan's case, the Active Gloucestershire Insight Hub, which could be accessed by wider colleagues. But this was also the case for colleagues in government departments. We had planned from the beginning to develop a policy briefing, and at the University of Bristol we're really lucky to have a team called Policy Bristol who can support us in writing these, but also in helping us to develop a database of relevant politicians and help disseminate it. So we shared a draft of the policy briefing with the impact group, and they gave us really helpful feedback, especially in relation to bringing out the implications for policy and connecting it to current agendas. But again, we shared the final briefing with the impact group, and they shared it with their channels. And with the help of Policy Bristol, we also shared it directly with politicians like MPs, lords and councillors who work on children's health and well-being and sport. The policy briefing reported primarily on changes to children's physical activity and the data that we had that explained this. But we also had data on children's participation in active clubs and some really interesting findings as to how this had changed since the pandemic, which weren't covered in much detail in the policy briefing. So after speaking with an impact group member who was a local club provider, it was clear that the briefing was heavily policy relevant and less so for those delivering the sport and physical activity opportunities. So we were advised by them that a one-page summary of our findings that focused on active club attendance was the most helpful format of our data for club providers. We drafted a copy and took this in person to a staff meeting of the local provider, and gained really helpful feedback on what was most interesting to them in it, and the best language to use, how to make it most appropriate to their sector. We shared that summary with providers across Bristol and also schools that have been involved in the study. In order to make our academic research more accessible to pretty much all of the stakeholders that we mapped out and had in our plan, including policy and practice colleagues, we wrote short blog posts in plain English that summarised key academic papers as they were published. And Alan mentioned this. So like key to this was having our partners, such as Alan, being able to give us access to their organization's blogs for us to reach those audiences and then to their publics as well. So this is a screen grab of the blog post we did for Alan on and Active Gloucestershire, which they published on their Week in Move blog. Finally, just to briefly share, we made an online hub to be a central location for all of the resources we were creating. At the top of the page, we pinned the policy briefing and a short animation that we produced that summarized the study findings as the two key ways to find out very briefly and simply about the Active-6 study. And below you can see we made folders for each stakeholder group to bring the resources that were relevant to them together in a very easy to access way.
So for me, I wanted to just sort of share some of the key kind of learnings that I had from this. And right from the start, I talked about how this came about from developing relationships with the researchers. And I think that was absolutely key. It's a long-term relationship where it started 4 or 5 years ago, and it's continued to now where sort of Danny asked me to come along and sort of co-present this. And so I think that's really key in that there's a range of voices and a range of people involved in the research and developing it and having a say on the findings as they come through. So it really did then help my understanding of the research and early findings and how I can bring in other information that can support it, how I can have an influence and say on kind of the next stages of the research, and sort of really have a good say in sort of not only my voice, but that broad range of voices that Danny talked about earlier. I thought that was absolutely key to make sure that there is a broad voice going into this research and developing that as it went along. It created a space for organizations to collaborate around a shared interest. So there were other people within the group that I hadn't had sort of interactions with before. So that was really helpful to build relationships there, broadening the people discussing these sort of evaluations and researches and sort of really sort of building on the conversations and then fostering an interest and a desire to keep these research going. And I think most of us were keen to support follow-up sort of projects that sort of were being looked at afterwards. And so that just led into that openness to collaborate. And I'm really pleased with and sort of was impressed with Danny and the team around how they were so keen to collaborate on ideas for presentation and dissemination, and also to listen to our thoughts and our voices in terms of what we were seeing from the learnings that they were picking up as they were going as well.
Yeah, so I'll just finish now with sharing some of the learning that we in the research team have when we reflect on this work and what we've taken forwards and what we'll continue to take forwards in the future. And hopefully there'll be some useful points in there for others. So overall, close working and engagement with policymakers and practitioners throughout Active-6 was very helpful for the study in general and specifically for disseminating study findings. We were able to understand what of our data was most relevant to policy and practice, make sure that we were creating the right tactics and resources, and could collaborate on disseminating our findings through channels we might not have otherwise had access to or even known about. My second main learning is the benefit of planning for dissemination. I hadn't done this so strategically before. Mapping and planning out the audiences, channels, and tactics was really helpful to think through communicating our findings to different audiences. I think it's useful to map out stakeholders as early as possible in a project and start reaching out to them and making connections, although it's like never too late to start doing that. And absolutely do a communications or dissemination plan and maybe use the audiences, tactics, channels model because yeah, I found it extremely helpful. The third point is that this was a lot of work, but it was worth it. It took a lot of time, and I need to be clear that there was a small team of us working on this, and it's not just my work. And that also, in my position of being a study manager on Active-6, I had the capacity to do the work of the relationship building, etc. So I'm aware that not all studies have this capacity, but it was worth it. So the impact group has now continued with us into our current project. And it's also expanded, so it's now about 35 people. So it's something that's growing and evolving. And we're still learning how best to do this and trying to adapt with a larger group now and a very different kind of project. We're looking at how to change the format of our meetings so there's more space for conversation across the group, for example. So we're constantly trying to tweak it, improve. Fourth is that it's worth nurturing relationships and networks. And I see the impact group meetings as kind of part of that process. Like the regular meetings that we had started to create a bit of a community and a network. But it's worth it, as Alan mentioned. Like it's evidence is that he's here today, willing to do this with me. Yeah, and my learning is that more often than not, people are happy to meet others working in the same area from a different approach, and very happy to have half an hour chat to find out what each person is working on. Like it's helpful for everybody to cross-pollinate and work collaboratively. The fifth kind of learning is that you can be strategic with what you choose to do. As I said, I was lucky to be in the project manager position with capacity to push a lot of this forwards. But within any limitations that you have in terms of time or other resource, you could choose one or two key bits of dissemination work that would be meeting your main dissemination goals. Reflecting on what we did with Active-6, I think there's always more that we could have done, but it's just helpful to be strategic about it, to prioritize and to collaborate with others when there's chances to. Sixth point is to try a lot of things if you have capacity, and one or two might go somewhere. So I think what worked for us was pushing on lots of doors and seeing if one or two of them might make an impact. Our dissemination resources weren't all hugely successful, so I'm not sure the summary for club providers that I shared made much of an impact with people we sent it to. We didn't have much response back from that. But it was good relationship building with the provider that we developed it with, and it kind of demonstrated to them our understanding of them as a specific sector. But other resources did lead to doors opening. So we emailed the policy briefing to the Shadow Secretary of State for the Department of Culture, Media and Sport, who happened to be our local MP. And this led to a private meeting with her to discuss the study findings. And the final point I wanted to make was bringing it back to the NIHR standards, which is that, as you've seen throughout this presentation, this project was stronger in some of those standards than others. I don't think what I've shared today is kind of typical PPI. But yeah, it definitely created a project that was stronger in standards such as working together and communications than others such as inclusive opportunities. But I think that's okay. So it's helpful to think of all of the standards and how they can be brought into your research and make you question your plans. But they won't all be covered to equal measure in each project. So I'll finish there. That was our experience of how we tried to work closely with policy and practice colleagues in order to address the project goal of sharing findings rapidly to inform decision making and policy. But I'm sure others in this group and on this call have tried other things in your work, and it would be really interesting to learn from others' experiences. I've just got a few resources we can link you to. So for more information on the Active-6 study, we have the hub that I mentioned, where you can find all of the dissemination resources we created and links to all of our papers. And there was also, just recently NIHR have published our study synopsis. So you can find information in depth on the whole study there, but there's also particular sections in that report on PPI and on the impact advisory group. And finally, just wanted to thank the rest of the study team and everyone who did this work with us. And to the members of the impact group and the study steering committee, and particularly all the schools and school staff and parents and families that took part in the study.
Thank you, Danielle and Alan, for a fantastic presentation. I'm just going to run through some of the questions. So we've had a few questions in the Q&A. Can you say more, please, about the distinction between the steering group, management group, and impact group?
Yes, so the steering committee was a group of academics, well, 3 academics and 1 parent, who we met with less frequently, and they basically had to approve the study as it was going and just check that we were sticking to protocols and plans and was on track. So kind of an oversight group. The study management group was the majority of the team that I just had on the list there, including a parent member. And we met monthly that just reported on how the data collection was going, any issues as they were arising, and decision making on the sort of day-to-day running of the project. And then the impact group was the policy kind of colleagues and practice colleagues, which we got together about every 6 months. But in between, particularly as findings and dissemination was coming out, we would share things virtually as well between those meetings.
Fantastic, thank you. Next question is, would you agree that a collaborative approach with PPI is co-production, not consultation, which is very different? Would you agree that people in this situation who are bringing lived experience are in a relationship of equals?
Probably wouldn't agree with that. No, I think that it was much more of a kind of, yeah, I feel like collaboration is maybe the right word for me, for how it felt with what we were doing. I wouldn't call it co-production because the a lot of the work and the decision making was sat with the research team, but that kind of wasn't the goal of the project. So yeah, but I think it was a very kind of like open and close relationship where people's what each person could bring to the group and bring to the project was quite kind of clearly defined, and there wasn't trying to separate out of like, you know, everyone wasn't trying to do everything. People brought their knowledge and expertise to it, and then the majority of the work on the labor on it still sat on like our shoulders as the research team.
I think I'd agree with that. I think our level of involvement was really good for being consulted on, informing, influencing, and then sharing. I don't think our level of involvement sort of reached the sort of the co-production side of things. It's definitely, we were sort of used for our focus and our view on life and our experiences, rather than actually developing it directly.
Brilliant, thank you. Next question is, were there any stakeholders that you later ruled out, and if so, why?
No, I wouldn't say anyone that we ruled out, but I would say that our learning around who the key stakeholders were evolved through the project. So I think what we lacked or had less attention on at the start, and this has evolved into the current project we're doing now, which is still working with children's activity in schools, is the involvement of educators and people in the school sector. So we've tried to, you know, our learning, we've realized how much more like how kind of we really need to bring them involved. They need to be much more of a part of the work that we're doing. And we've basically been trying to do that since then, and have that perspective involved in, yeah. So the Department for Education has been a group that we've found harder to build networks with, but we're slowly getting there.
Brilliant, thank you. Did the data take into account disability and chronic illness in children? And if so, how was that distinguished from the primary data?
No, it wasn't. So we recruited across all year 5 children in each school, and any children were able to be involved in the study.
Thank you. How did you build in sustainability to the central hub, for example, costs, so that it can be made available after the study finishes?
Yeah, so it's hosted by an organisation called Active-6. They're based in Glasgow or Edinburgh. They're in Scotland. And they have a remit where they work on trying to support physical activity through networks, and particularly through their digital platform that they have. So they're a very unique organization that we have the ability to work with because of our shared goals. And so Active-6 offer this this hub platform. Anyone is able to create a hub on their platform for free. And as long as Active-6 exists, the website and the hub will exist. And so there isn't a cost attached to it, which is why we went for them. I appreciate that that's not something that like every focus of research would be able to do.
Thank you. How did you measure the impact of all of the wonderful dissemination?
It's a really good question, and it's very, very hard to do. That's still something that's ongoing and a struggle. We every time I get some feedback from someone, I capture that. So that very kind of like loose but written feedback from people, if they tell me how they've used the resources that we've made or how useful they were, I capture all of that. From a kind of more policy perspective, I've been using, like, every now and again I log into a system called Overton. I'm not sure if it's something that all universities have access to, but at Bristol University we have it. We can put it in the link in a moment. But it's a tool for searching policy and grey literature and seeing where any citations of your work get mentioned. So that's been quite useful to use, just to see if any of our papers or resources are being mentioned at any point. But yeah, the measuring the impact bit is like the hardest bit.
Yeah, absolutely. What was the best technique for sharing information with stakeholders? Did you find that one stood out above the rest across stakeholders?
No, I wouldn't say it. I think it just had to vary and to be tailored for um, each audience. So that's the hardest bit, really, realizing there was no one approach that worked best above all. So yeah, that was the tricky thing, realizing kind of how much work there was in doubling it up for each kind of audience you were trying to reach. I'm not sure if Alan had anything to comment on that one.
No, it's difficult. It was, I think, because we were able to capture or reach out to a wider audience, is then each ones will have different methods of measurement. And sometimes, as Danny said for the last question, it's really hard to measure that. So it's hard to understand which one works best or anything like that. So I think just producing more options to have the opportunity to reach more, I think was absolutely key.
Excellent, thank you. You mentioned it being a long process. Was this done prior to the research funding or during the process? If so, how did you build in the time within funding constraints?
No, it was during the process, but the project was funded very rapidly, but the initial kind of establishing of the impact group heavily relied on the sort of mainly senior members of the research group and the networks that they already had that they brought into it. And that was the kind of initial basis of the group. But then, no, the rest of it was done throughout the study as we went along, because the kind of time between planning the project and getting the bid in and delivering it was very, very quick, because it was this like rapid call during the pandemic. Yeah, so it was something that we just did as we were going. And one thing to note is, I guess, that I started a lot of the dissemination planning and work like before. It's that kind of problem of the time lag of academic research and published findings. So we tried to develop as much as we could, even in advance of having our final findings, so setting out some of the plans and the sort of the networks, at least our intentions, even templates for stuff in place before the findings were finally published, and that we could then kind of public dissemination of findings once they had been through the peer review and publishing process. But it's that's a really tricky thing to juggle, that kind of academic time lag that you have around things getting out rapidly and being relevant versus how long it takes to get them published.
Yeah, absolutely. Thank you. What did you think the main impact was of involving PPI members on the research?
I think for the policy and practice stakeholders specifically, it's just improving all of these materials and being able to reach their audiences in a much kind of more effective and impactful way than I would have any sort of version of doing this without their involvement would have been. Yeah, and then I won't go into the PPI with other kind of stakeholders, but obviously the involvement of schools and parents and families just improved our plans for going in and working with schools and doing data collection, but particularly during still quite a lot of COVID restrictions. So yeah.
If you had co-production, do you think that the result might have been more valid and respected by stakeholders?
I think depends on the stakeholder, but I would definitely want to ask Alan his view on this afterwards. But my feelings with the policy and practice colleagues is that they weren't necessarily looking for co-production in this. Like, people are extremely busy and have their own agendas, so this kind of collaborative working seems to work quite well. Although like I said, we're still trying to evolve this and tweak it a little bit in our current study, to have to try and have people's input in a slightly more cross-pollinating way. I think it could have been more useful when it comes to more like the schools and the families' involvement. I think we could do better, or like more work there in terms of co-production with schools. Again, very hard because of how busy they are and how hard it is to get their time. But yeah, I wonder what your perspective is, Alan.
Yeah, I think it's an interesting question because I'm a massive fan of co-production, and especially done properly and fully right from the start. I think for this, it would have been really challenging because one of the great things was, you had 25 different people in our part of the collaboration, and having those views. And I don't think any of us would necessarily have had the time to properly co-produce this with you. Whereas the research I talked about before with We Can Move, where we had 2 years and we had an embedded researcher who was in the office 1 day a week, the development and what that evaluation looked like was properly sort of co-produced, but there was a different relationship there, and there was a different outcome. I think for something like this, co-production I don't think it would have worked from our perspective anyway, and it would have probably made things tougher and slower from your side. But it's definitely, I think it needs to be designed like that from the outset, and it's probably more beneficial to be having the people that you're actually sort of studying, such as the children and their families, as co-producers, as opposed to the groups that I was part of.
Thank you. So there's a sort of suggestion here. I would suggest that you can measure engagement and dissemination, but this has to be built into the plan. And then following on from that, there's a question about whether you evaluated engagement and dissemination, and if so, how?
No, not hugely. So I'd really welcome any advice and thoughts that people have on that. I think part of it is the kind of the structural challenge of moving on to the next project, and now being very busy on the next thing. So yeah, all I kind of do every now and again is have a little look at how many people are looking at the website, and like I said, use Overton to track and see if any citations are happening. But yeah, I'd be really welcome to any advice that people have on that.
Thank you. Did you use any frameworks for this work?
No, I mean, just the kind of the suggestion from the ArcWest communications course that I attended. So I don't know if that counts as a framework or not, but that for me was new. I haven't got a comms background, so it's funny because you think that it's probably just absolute basic bread and butter for any comms person to think about things in this way. But for me, it was relatively novel, and very helpful. But yeah, that was the only framework.
Thank you. Did you ensure diversity as part of your study?
No, we were looking at just recruiting. It was very the spring or like early 21. We were very much still in the pandemic. It was very difficult to be getting into schools and accessing. So we were just recruiting as many children, any children that we could from year 5s across these schools. And it was all quite rushed and just very responsive. So yeah, if we were to do something similar again, we would absolutely need to do better on those sorts of things.
Absolutely. It's worth noting that obviously, like you said earlier, it was a fast track, wasn't it? And during the pandemic, so slightly different to how you might approach a sort of a standard, straightforward study. So
Yeah.
I agree. Did you come up against any barriers when involving members of the public? How did you ensure research inclusion to gain reflection of the general population?
So barriers with members of the public. I guess the members of the public that we recruited or included in the study were the families. We had fairly mixed kind of participation depending on schools. It was yeah, I'm not sure how much there is to say on that one really. What was the second part of the question, Dawn?
Yeah, so how did you ensure research inclusion to gain a reflection of the general population? So I think you probably have answered that before about diversity.
Yeah, but it definitely like in the current project that we're doing now, where we've got a lot more time to really think carefully about inclusion and recruitment of schools and then of families within those schools, we are considering all of these things and putting stuff in place from from the start point. No, definitely looking back on Active-6, there more of the schools that were involved, for example, were from more advantaged neighborhoods. The schools who were able to sort of say yes and respond in a very quick way or let us in, we definitely ended up with more privileged children via those schools being involved in the study, and that's one of our limitations for sure. So yeah, I think it was that kind of question of how quickly this all had to happen. But yeah.
Yeah. And what would you say this is the last question, is the main positive impact that this study has had on its target group, the parents and children?
Good question. So I think it's kind of via sharing this with policy and practice and the people who are decision making. So I feel like this has been part of the evidence base that has been building from not just us but other organizations working in the sector that is showing the inequalities in children's physical activity and how they have increased since the pandemic. And so there is, most organizations working on this in terms of policy and practice now are being quite targeted at who they're trying to work with. So I would hope that our evidence has been a very small part of feeding into that, and that that is the round the houses way of having an impact on the families. Yeah. Alan, did you have anything on that one?
I think the fact it did gain traction and there were sort of, had local MP interested and things, and I think that all helped and it fed into other research as well. So I know from our perspective, we were able to use it to bolster up the research that we had and the work we were doing with creating active schools. So it sort of had an impact there as well, and that sort of framework is doing really well as well.
Thank you. And another question, or a couple have come back in. So it might be interesting to find out if there are any cultural or socio-economic barriers to children being active. So that's more of a sort of suggestion. Oh, sorry, I've just lost the other one. Bear with.
And I think from that one as well, it's that's where we have a lot of the national information. So the Sport England's Active Live survey has a children's version as well. And for us in Gloucestershire, we have a local one where we have 20 to 30,000 children respond every other year to a survey around general health, which includes physical activity, and absolutely those socioeconomic barriers shine through on that. And it's very clear. So I think you can see that from more national stats.
And we have it also in the qualitative data that we did in Active-6. So we've got particularly well in terms of gender and socioeconomics, we had evidence on inequalities increasing. We didn't have enough of a sample of minoritized ethnic groups in the study to kind of say anything significant on that.
Thank Thank you. And that last question was in relation to that and was a further point. So that's the Q&A completed. Thank you, everybody. So the next slide. So thank you again for a fantastic presentation today, Danny and Alan. I just wanted to say that we've got another upcoming event, another webinar as part of this PPI in Action webinar series. That is on the 12th of December at 2 till 3, and you can register now. So all of that information is out there, but please do get in touch if you can't find the link. And we will also be sending the slides and an evaluation form for today's webinar. So we'd be really grateful if you could complete this to help us to shape our future webinars. Thank you very much, everybody.